Guys, welcome to another video. So in today's video we'll be looking at hypothyroidism. So hypothyroidism is a health condition where the thyroid gland does not make enough thyroid hormones for the body. That's the summary of it. So basically, this thyroid gland is a small butterfly shaped gland that is found at the front of the neck, just below the Adam's apple. And even though it is small, it plays a very big role in controlling how the body functions. So these thyroid hormones, they are like the body speed controllers, and they help with how fast your body uses energy, like your metabolism, how fast your heart beats, how warm your body feels, how your brain works, and how your digestive system moves. When there's not enough of these hormones, your body kind of like slows down because the speed controller is not sufficient enough. So this is a summary of how the thyroid works. So basically, your body uses a system that works like a thermostat. So the pituitary gland in your brain watches how much thyroid hormone is in your blood, and if your thyroid hormone is too low, the pituitary gland releases a hormone called thyroid stimulating hormone, TSH, and TSH tells your thyroid to make more thyroid hormones as far as stimulating the thyroid to produce more hormones. Then in cases of hypothyroidism, even if TSH is calling for more hormones, like telling the thyroid, these hormones are not enough, you need to produce more, the thyroid gland usually doesn't respond well or cannot keep up to the constant demands for these hormones. So for the causes of hypothyroidism, there are several reasons someone can develop this hypothyroidism. Like, number one, autoimmune disease, which is known as Hashimoto's thyroiditis, and here the immune system strongly attacks the thyroid gland and damages it. So this is the most common cause. And then we have iodine deficiency, and the thyroid needs iodine to make its hormones, and if a person doesn't get enough iodine from their food or from water, the thyroid can't work properly. And then it could also be due to surgery that has been done to remove the thyroid. So if someone has surgery to remove all or part of their thyroid, they won't make enough hormones anymore afterwards due to this procedure. Then it could also be due to radiation therapy, like radiation that is used to treat cancers in the head or the neck area can end up damaging the thyroid gland. Then medicines too, like some drugs, like for example lithium or amiodarone, they can interfere with thyroid hormone production. Then there's also congenital hypothyroidism, whereby some babies are born without a thyroid gland or with one that does not work well. Then even after pregnancy, there's something that is called postpartum thyroiditis. So some women develop temporary hypothyroidism after giving birth due to changes in the immune system. So for the symptoms of hypothyroidism, because thyroid hormones affect almost every part of the body, people with hypothyroidism, they can have many different symptoms. So these symptoms usually develop slowly over time. And here are the most common signs. There's feeling very tired or sleepy, weight gain even without eating more, like you are eating normally but you are just gaining weight. Then cold intolerance, feeling cold almost all the time, dry skin, constipation, depression, low mood, lack of interest, slow heartbeat, hair loss or thinning hair, swelling in the neck, which is known as goiter, is like an enlarged thyroid, then puffy face or eyelids, having a hoarse or deep voice, irregular or heavy periods, slow thinking or having memory problems like brain fog, slow reflexes, and then there could also be swelling in the hands and feet. In babies, signs usually include poor feeding, long-lasting yellow skin known as jaundice, and signs of slow growth. So for the diagnosis, doctors diagnose hypothyroidism by doing a blood test. So they check for the TSH, that is the thyroid stimulating hormone, and this level is usually high when somebody has an underactive thyroid, when somebody has hypothyroidism, because like I said, this thyroid stimulating hormone, the function is that whenever the child is not producing enough hormones, it goes to trigger the thyroid to produce more hormones. So it's high when the thyroid is not doing its function. So when this TSH is high, it means that the thyroid is underactive, because the brain is trying to get the thyroid to make more hormones. Then in the blood test too, they check for free T4, that is thyroxine, and this level is usually low in hypothyroidism, since the thyroid isn't making enough hormones. Then some thyroid antibodies too. So if the doctor suspect an autoimmune cause like Hashimoto's thyroiditis, they may check for antibodies like TPO antibodies in the blood. So for the treatment, there is no cure, but hypothyroidism is easily managed daily medicine. So the main treatment is levothyroxine, and this is a tablet that replaces the missing hormone in your body. So it works just like the hormone your body is supposed to make. So how is it taken? It's taken once daily, preferable in the morning on an empty stomach to 16 minutes before eating. Then avoid taking this levothyroxine with calcium, iron, antacids, or multivitamins, because they can block the absorption of this levothyroxine. Then the dose usually depends on the person's age, their weight, how low their hormone levels are, and other health conditions like if they have heart problem. And blood tests are usually done 6 to 8 weeks after starting this levothyroxine, or after changing the dose, to check if the dose the person is taking is actually correct. So once the right dose is found, the blood test may be done every 6 to 12 months to make sure the levels stay normal. So in special situations like pregnancy, the body needs more thyroid hormone during pregnancy, and the dose of levothyroxine often needs to be increased. So low thyroid hormone in pregnancy can affect the baby's brain development. And then in older adults and heart patients, these patients are usually started on a lower dose to avoid this levothyroxine stressing the heart. So if hypothyroidism is not treated, it can cause infertility, it can lead to high cholesterol and heart disease, it can cause goiter, it can cause severe depression, it can slow the growth and mental development of a child, and in rare cases it can also cause a life-threatening condition called myxedema coma, which is a medical emergency. So in summary, hypothyroidism is when the thyroid gland doesn't make enough hormones, causing the body to slow down, and symptoms include tiredness, weight gain, constipation, and cold intolerance. And it is diagnosed with blood tests, like if the person has high TSH, low T4, and is treated with a daily hormone tablet known as levothyroxine. And most people with hypothyroidism will need lifelong treatment, but with proper care they can live a healthy and normal life. So thank you for watching. I will see you in the next video. Bye.